The year 1918, the world faced the Spanish flu. A century later, in 2019, COVID-19 emerged. Both pandemics brought the world to its knees. Widespread illness, death, and societal disruption ensued. Both tested scientific limits and human resilience. In 1918, public health measures were rudimentary: isolation, quarantine, and basic hygiene. Masks became commonplace, but their efficacy was debated. Information, often inaccurate, spread slowly. Fast forward to 2019. Governments armed with a century's worth of epidemiological knowledge responded with varying degrees of urgency. Lockdowns, travel restrictions, and mass testing became the new weapons in the fight against the unseen enemy. Public health messaging, amplified by the internet and social media, became a crucial battleground. The speed and reach of information, however, were both a blessing and a curse, facilitating the spread of misinformation alongside vital public health guidance. In both pandemics, healthcare systems strained under the weight of the sick. Hospitals overflowed, healthcare workers faced unprecedented challenges, and shortages of essential supplies became commonplace. The world, it seemed, was caught somewhat unprepared. Both the Spanish flu and COVID-19 inflicted deep wounds on the global economy. The 1918 pandemic coincided with the end of World War I, further exacerbating economic instability. Businesses shuttered, trade routes froze, and unemployment soared. A century later, COVID-19 triggered the most significant global economic downturn since the Great Depression. Lockdowns and restrictions brought industries to a standstill. Supply chains, already stretched thin in our globalized world, snapped. The economic impacts, however, were not evenly distributed. The pandemic exposed and exacerbated existing inequalities, disproportionately impacting low-income communities, essential workers, and marginalized populations. Governments around the world responded with unprecedented economic stimulus packages, attempting to cushion the blow and stave off economic collapse. The long-term economic consequences of both pandemics, however, continue to reverberate. Section 4. Life finds a way. Humanity's capacity for adaptation was evident during the Spanish flu and COVID-19. Social distancing transformed our interactions. Handshakes became taboo. Schools transitioned to online learning. Remote work became mainstream. We reevaluated priorities and found new ways to connect. The pandemic highlighted the value of community and resilience. Virtual events maintained normalcy. We adapted, innovated, and rediscovered human connection. Section 5. The Tools of Tomorrow. The Spanish flu pandemic spurred advances in virology and epidemiology, laying the groundwork for the development of vaccines and antiviral drugs in the decades that followed. However, these advancements came too late to mitigate the devastating impact of the 1918 pandemic. A century later, the world was better prepared scientifically for the arrival of COVID-19. Advances in genetic sequencing allowed scientists to rapidly identify the virus, while international collaboration facilitated the sharing of knowledge and resources. The development of mRNA vaccines, a testament to decades of scientific research, marked a turning point in the fight against COVID-19. These vaccines, developed and deployed at unprecedented speed, offered a glimmer of hope in the midst of the pandemic. The COVID-19 pandemic, while devastating, also accelerated advancements in telemedicine, diagnostics, and data analytics. These innovations hold promise not only for future pandemic preparedness, but also for improving global health outcomes more broadly. Section 6. Scars and Silver Linings. The Spanish flu and COVID-19, two pandemics separated by a century, left an indelible mark on human history. They serve as stark reminders of our vulnerability to infectious diseases and the importance of robust public health infrastructure. They also highlight the interconnectedness of our world and the need for international cooperation. While the scars of these pandemics run deep, they also offer valuable lessons. They underscore the importance of investing in scientific research, strengthening public health systems, and addressing health inequalities. The COVID-19 pandemic, in particular, has forced us to confront the fragility of our planet and the urgent need for sustainable practices. it has also revealed the adaptability and resilience of the human spirit. As we emerge from the shadow of these pandemics, we carry with us the hard-won lessons of the past and the hope for a healthier, more resilient future.